Um, what I'd like to do is welcome you all. We have some exciting news here today. Today we've got two new people who have joined us. We've got Chris, or rather Keith McCormick, who is a student at UIA, who's going to come in as an intern. And then we also have Santiago Julio, who is a AmeriCorps Vista volunteer with the Business Enterprise Institute. And so they have come in and they've joined our team and are going to help us grow the House Tide. So today I'm really pleased to introduce you to Dirk Sokensen. He's with Seresti Health, and he has a business that helps families who are dealing with elders with dementia or Alzheimer's. Are you with us right now, Dirk?
Yes, can you hear me?
I sure can. Well, welcome to Health Tide. We're really excited to have you here. I'm hoping that you have a better time with sharing your screen than I did, but would you be ready to give us your presentation?
Yes, absolutely. So let me try to share my screen. And let's see. Tell me if this works.
Yep, you look great. You know what you're doing.
My wife might disagree with you on that. Okay, so would you like me just to proceed, Jacqueline?
Would you please introduce yourself and tell us a little bit about how you came to this business and then do your presentation?
Yeah, so first of all, thank you very much for the opportunity to share what we're doing at Seresti. My name is Dirk Sokensen. I'm the CEO and the co-founder of this company. Prior to starting Seresti, I was, an entrepreneur who started a medical device company that kind of created the space of what's known as digital pathology. So we built instrumentation that pathologists use to, digitize microscope slides. And I shared with Jacqueline that, we had a system in Ketchikan that allowed remote surgeries to be done at Ketchikan Hospital to be reviewed by a remotely located pathologist. So, it was a company, we raised venture capital. We had what's called a successful exit, which means we sold it, and then we went on to really try to think about how can we improve the quality of life for people who have Alzheimer's disease living at home. So Jacqueline, are you still hearing me?
I am. I'm still hearing you. You sound great.
Okay. Would you like me to proceed with talking to my slides?
Yes, please.
Okay. So, at Seresti, as you'll see, we're really sort of focused on how do you operationalize a family member? So an unpaid, informal member of the family, typically a spouse or an adult child of somebody who has lots of chronic conditions, who can't self-manage. So our primary goal at Seresti is to really improve cost and quality outcomes for people who are pretty sick. And we're starting with those who have Alzheimer's disease and other dementias, but as you'll see, the platform really supports providing care for people with other types of neurologic and other challenging conditions. So, what we have developed is really expertise in empowering family caregivers of multi-chronic patients, starting with those with dementia in the home. And for those of you who don't know some of these statistics, about 14% of people in the 74 to 85-year-old range have dementia. And then once you're above 85 years old, you have about 35% of people with dementia. So it's pretty significant across the board. For those over the age of 65, you have 11% of people have dementia. So it's pretty significant, and it's of course underdiagnosed. And it turns out that people who have dementia go to the hospital or the emergency room or have a stay in a skilled nursing facility at a rate that's 2 to 3 times higher than people who don't have this. And many of these admissions to a facility are actually avoidable and unnecessary, and in many cases do harm to the patient. So everybody has an incentive to keep somebody with Alzheimer's disease or dementia out of a hospital, provided that it's appropriate that they not be there. So if they cut their hand off, obviously they have to be there, but for many reasons, it's actually avoidable. And so I'll share with you what we do now, but we have developed a technology-enabled service that really allows our customers, which today are, payers and providers, to reduce like hospitalization rates by more than 20%. Today, we work with a provider group that's headquartered in California, but we're active in Albany, New York, Buffalo, New York, in Harrisburg, Pennsylvania. We're also active in Minnesota with Blue Cross Blue Shield of Minnesota in really engaging family caregivers of people or patients who have lots of chronic conditions and also have dementia. Blue Cross Blue Shield of Minnesota has actually made a small investment in our company. We are a investor-backed company. And then I'll share with you a little bit later, but as a preview of the data and the slides, we did a pilot study where we showed that we could reduce sort of monthly medical costs by 33%, working closely with the provider group. So that's really pretty impressive. We did that in what's called the Medicare Advantage population. So these are folks over the age of 65 that get their Medicare through a company like, Kaiser or Providence or United Healthcare and so forth. So just to kind of back up, what we really do is we take this person who can't self-manage because they have dementia, the patient, and in the case of dementia, they can't self-manage for several, and that has several consequences. So one is that they can't manage their chronic condition. So think about somebody who has diabetes and how hard it is to manage their diabetes. Now, if on top of that they have dementia, it's much more challenging, and their cost and facility utilization is much higher. So people with dementia typically can't manage their chronic conditions. They have a much higher rate of falls and urinary tract infections, and their family caregivers typically really don't know how to provide the best care for their loved one. So we actually engage the family member, and this is the person shown in white here on the screen, with a program that combines technology and coaching. And so the way that this really works is, we have a platform. So we have a digital platform that comprises sort of, iPad-like devices, tablets, smartphones. We have content that we've developed that really educates that family caregiver. So some of our content has been licensed, some of our content we've developed ourselves, but it's been optimized for use for somebody who could be 80 years old and really can't use technology. And then we have tools that we developed that, address various unmet needs of families. We have a tool, for example, called Helping Hands that allows a caregiver to actually reach out to their circle of friends and families and ask for support. And if they make a request like, hey, I need, somebody to pick up my medications at this pharmacy tomorrow at 4 o'clock, somebody in their circle of friends and family can say, hey, I'll do that for you. So it's a nice way for people to reach out for help. And we found that this is going to be very valuable to family caregivers so that they get the experience of increased support. We have coaches. So our coaches today are sort of social workers who coach remotely. So they're based here. We're based in San Diego. They coach these family caregivers remotely. We've built a dashboard for our coaches so that they can manage lots of families simultaneously. And then, everything we do is founded in the belief that we have to personalize what we do in order to drive what's called engagement. So for us to get people to kind of do what we want them to do on the tablet or otherwise, we have to get them engaged. And so, the more personalized we can make this, the better we are at engaging people. And so we do a series of like remote assessments to understand who that caregiver is, what's their preferred social style, what's their, belief around healthcare, what's their personality, what makes them tick. And so we can then figure out how to coach, engage, and motivate them. And so typically, here's a picture of what a tablet might look like. So you'll get like a Samsung tablet. It's kind of locked down. You don't need a cell connection. And every day you are assigned some tasks. And so we expect you to sort of go through these tasks. And then we can monitor remotely, whether you've done that. Our coaches will have a conversation to make sure you understand some of the educational content and have a sense of where to access support. So just to kind of recap, we today work with the care management team. We typically get the care plan. It could be an intake form that tells us something about their loved one's chronic conditions. And then we really engage them with personalized education, coaching, and support. And the outcome is that they become more knowledgeable, more confident, and more skillful at caring for their loved one. At the same time, we do daily remote monitoring, And we do this because our coaches develop sort of a relationship with that caregiver. So we know what's happening in that home every day. We also understand many of the health challenges and what people call social determinants of health that are happening in the home. And then we can make alerts to the care management team so that they can actually take an action to either like visit somebody in the home or say, hey, change your medications, go to urgent care, go to primary care. And it's really the combination of this caregiver empowerment and the subsequent ability to do daily monitoring that allows us to then really intervene as necessary, or allow us to make the care management team aware of problems that exist in the home so they can intervene. So just to give you a sense of what these alerts look like, here's a screenshot. Every day we ask the caregiver to complete a daily assessment, says, how was your day? Meaning the caregiver, how was Tom's day? In this case, Tom is the spouse of the person who's completing the assessment. And then, here's an example of some tasks that we asked them to sort of check off. So say, hey, was there a change in pain? Did your loved one not feel well? Was there a fall? Maybe you went to urgent care. Maybe you missed the medication. Maybe there's a new medication. So this list can be personalized based on whatever the specific challenges exist for that family. So based on that, we can then look at a number of outcomes. So I'm going to show you some of the results we had with this pilot study we did with this medical group. The company's called Landmark Health. So the highlight from the cost side is that we reduced their Medicare Part C, which is their monthly medical cost, by about 33%. And we did that because of the alerts. But also noteworthy is that we demonstrated a reduction in caregiving burden. So, this is a standard clinical instrument for assessing caregiving burden called the Zares Burden Assessment. And reducing the burden really means that the caregiver has, something left in the gas tank and is prepared to keep going. So if you were concerned about sort of keeping somebody aging in place and sort of delaying or obviating the need for them to be either placed in assisted living or skilled nursing, reducing the caregiving burden is very important. The Net Promoter Score is a measure of satisfaction. The 100 is the highest. So a score of like 92 is incredibly high in terms of satisfaction. So the caregivers thought that this was an incredibly valuable program. And then adherence means like what percent of the things that we wanted them to do over the course of a 3-month program did they complete? And so we got that to be close to 90%. And remember, half the people we're engaging are people who are in their 80s who've never used technology. And so the next plot here shows a little bit more on a monthly basis. We ran both 3- and 6-month pilots. How many minutes per week did we actually get people to talk to us? So you can see that what's nice is that as we move from month 1 to month 2 to month 3, the number of minutes, which are shown by the bar graph, increases, as you would expect as we're driving engagement. And so typically we're spending about 20 to 25 minutes engaging with a family member per week. And then the red line, which is aligned with the graph on the right, shows adherence, which means what percent of what we asked them to do did they complete? And you see that increasing over time as well. So when we show these results to a health plan who knows that engagement is very difficult, they get very excited to sort of say, gosh, you must know really how to do this, because not only are you increasing the amount of engagement you get month to month, but you're also demonstrating that you can get people to kind of do the things that you're asking them to do. And the theory of the case is if they engage in the things that are good for them, and they would typically engage for maybe an hour a week as a result of a 20-minute engagement by our coaches, you can get a lot of lift in terms of improving quality and reducing burden and also reducing cost. And so before I wrap up my last slide, I just want to highlight that we have a platform that is currently supported by Ceresti coaches that personalize content to families who are struggling with Alzheimer's disease. Family caregivers can play a big role in other diseases, so Parkinson's or mental health, traumatic brain injury, stroke, and even things like cancer or ESRD, which is kidney disease or recovery from surgery. So today we're focused primarily on Alzheimer's disease, but when you think more broadly, empowering family caregivers can be incredibly impactful in terms of improving patient care. And the other thing I just want to say is, we kind of have a technology platform and we have coaches. And I know as you think about how you might utilize something like this for your needs, while today we don't have we're sort of trained coaches that are part of the Ceresti team, we absolutely are believing that in the future, it's possible that these coaches could become, people that go through maybe a training program, but then they could kind of just use our technology platform and then deploy this solution, in their region with their specific, needs. So, when you look at what we're doing, I think we've done a good job sort of proving this works in dementia, but it is really a platform that could be used, for many other applications. So I'll stop there and take any questions, and thank you again for your time.
Thank you so much, Dirk. I can't say how impressive I am. Those statistics are really wonderful. I know that there's many people, me and many people that I know that this is an ongoing issue with family members. I'd like to open it up for anybody who would like to ask Dirk a question. Keep in mind that you can put your questions in the chat as well, and we'll try to answer them that way.
May I jump in with a question, Jacqueline? Yep, looks like a yes. Okay. So thank you, Dirk. That was great. This is Nigel Sharps. I'm one of the co-organizers of the Health Tie initiative that we're trying to do, and I'm kind of have a fairly standing question that I hope to ask to all of our speakers as we have you guys come in every month or so and engage with our community here. Talk to us a bit about, obviously that pilot study has been hugely important to you. But I'd like to understand a bit more about how that's affected the company and the growth around that. There's a little bit of a leading question here, so I'd love for you to argue back with me as well. But we're thinking of creating somewhat of a test bed for innovative enterprises like yourself here in Alaska to engage with our community and to have companies like you come in and build out pilot studies with that. So how important is that to an early stage and as part of the startup life? And anything you can speak to that would be really relevant, and lessons learned there as well.
Yeah. So Nigel, thanks. It's a great question. So, if I was a medical device company, which I had in my prior company, it was relatively easy. I could show it to you, I could demonstrate it to you, and based on what it did, you might say, hey, look, I kind of want to buy it. What we're doing here, the value is really embedded in the results of, what does the program do? Because I can't really demonstrate, how we personalize this for everybody. And so say, look, I can see how it could be valuable, but show me some results. So in that sense, we're a little bit more like a biotech company where, it's like a drug and you have to prove that it works. And then once you prove it works, everybody wants it. That really is kind of the situation we're in, because ultimately to an organization that might take financial risk for these patients, I expect to be able to walk in and say, if you spend $1 with Seresty, you can save $2. Now, imagine if I came and I said that to you. If you believe me, you'd be like, oh man, that's great. I'll do that all day long. But for me to prove that to you, I have to have enough of a study against a matched control that's statistically significant. We say, yeah, you know what? I really believe that you did a study where the impact that you achieved is attributable to you. So the most important way for us at Seresty to create value is to get an opportunity to demonstrate what we're doing with an organization that is willing to allow us to pilot this, and that gives us access to, claims data and other data, so that we can really then, either through their efforts or through our own efforts, show that we had a big impact. So for companies like us that do healthcare services, the data is the most important thing. And that's, in fact, where we spend most of our activities, is we go around and we show these results, and we see if there's early adopters who are interested in building more evidence about what we're doing.
And thank you, Dirk. So then a follow-on to that would be a question that I always like to stance a little bit more in the negative tinge, that if I tell you that we have a program like that here in Alaska that could maybe help you get a pilot as such going, but it's here in Alaska, what would your concerns be with a program like that?
Well, so the nice thing about what we do is we work entirely remotely. So we built this to be totally scalable. So we never meet our families face to face. Everything we do is remote, and that gives us a huge benefit in terms of being scalable. This is why we can, we're a small company, but we're active in 4 markets in the US, and we're about to go active in 3 more markets that are served also by a big company in the US called Humana. So in terms of supporting a program, let's say in Alaska, it would be relatively easy because it would all be done remotely. Obviously getting together for the meetings and to, making sure that we build a relationship before we do something, we have to get together. But I mean, we've flown to Minnesota, we've flown to, other parts of the US. So because we work remotely, I think we're actually particularly well suited, to doing this without it being hugely painful.
Thank you.
Hi there, I have a question. So
Hi.
I just wanted to ask, like, do the caregivers have to pay to get the services? Like, is there a cost attached to the caregiver?
Yeah, so this is a really good question. When we work with a Medicare Advantage plan, the Medicare, this is a type of insurance company that receives a payment from the government for everybody that they cover. So take example like Kaiser, or I'm not sure who your MA plans are in Alaska, but maybe Providence. I certainly know they have an MA plan. So we would get paid by the health plan. So this is offered today at no cost to the people that use our program. So this is a huge benefit when we work with a Medicare Advantage plan, that this is offered at no cost to the family. Now, if somebody wanted to privately pay for the program, they could, but we specifically are thinking that Medicare Advantage is a good first place to start, because they would like to save money, they would like to improve quality, and we do that for them. And the families, of course, would like to receive the program at no charge, and so we can make that happen as well.
Thank you.
You're welcome.
Well, Dirk, thank you very much. We, the community, would like to support startups like yours. What are some ways that we could work with you and other startups, and how can we wrap it? We're about 3 minutes away from wrapping up this call, but we'd like to continue this relationship. So what kind of things could we do with you moving forward?
Well, I think, as Nigel asked, and it's a great question, is we're incredibly interested in studying how this program works in different populations in different regions. And so to the extent that there are provider groups, so doctors groups that would be interested, or insurance companies that would be interested, or there's even community-based organizations that sometimes through grant funding can deploy a program like this. So I think all those are opportunities. And, we'd love to maybe follow up to see where would be a good place to try this out if there's interest. But, the fact that we are remote and scalable, I think, I would think makes this much more likely to be a possibility than us having to, hire a bunch of people on the ground in Alaska, which is difficult for any small company to do.
Fantastic. We will definitely do that. We have some people here who have many key contacts that would be very interested in this program, and we will actively try to reach out and see if we can find those connections for you. I want to thank all of you for participating today, and I'm going to take a last minute to kind of wrap up, but we have our next Open Innovation Thursday will be on May 4th at 1 o'clock. We're in the process of getting another presenter for that. Dirk, we'd like to invite you to continue to participate with us. So if you'd like to be included in these calls in the future, please do so.
Great, I'll do that. I'm going to stop the sharing of the slides, and I'll just listen and go on mute.
Thank you so much, and thank you everyone who participated today. Please reach out to Nigel